Hello everybody, I am Dr. Nivedita Pawar. I am a gynecologist, laparoscopy surgeon and IVF specialist. Today we are going to speak about the bleeding in women or the girls. The bleeding, everybody knows about menstruation. I have divided this topic into 4 subtopics because it is very important for any girl or the women. The first topic is about the menstruation. What is the menstruation? The second topic, the polycystic ovarian disease. Third is the dysfunctional uterine bleeding or the bleeding disorders, and the fourth is the menopause. So the menstruation, the world, everybody knows the menstruation. Menses, period or the problem. Normally in the family, everybody is shy to discuss about the menstruation. But nowadays, because of lot of awareness and openness in the family, the menstruation is quite discussed now. Menstruation is very important in any girl's life. It signifies the puberty. Puberty is like the period from the childhood to the adulthood. When the menstruation starts, normally it is at the age of the 11 to 15 years. So by 15 years, if the girl is not menstruating, then she should be investigated. So that is very important to know the age of the menstruation. This is called as a menarche. When the girl gets first menstruation, the family, the women, elder women in the family, they are very satisfied and happy that it signifies the presence of the uterus, the ovaries and the intact reproductive system, so that when the girl gets married, she can have the normal function of menstruation and the childbearing capacity. So it is very important. So menarche, after the menarche, the cycles can be regular or irregular because her reproductive hormones or the reproductive organs, they are not fully matured. So nobody should expect that immediately after the menarche the period will be regular. They may be regular or they may not be irregular. So let us understand what is the anatomy and physiology, why the girl starts menstruation. In our brain there is a glands like a hypothalamus and pituitary system. Hypothalamus secretes hormones which stimulates the pituitary gland to produce the follicular stimulating hormone, luteinizing hormone, prolactin hormones and the thyroid, which stimulates the ovaries to stimulate the hormones estrogen and progesterone. They are very important hormones. Anatomically, every girl is having the uterus, which is situated in the lower abdomen, and along with the uterus there are 2 fallopian tubes or the uterine tubes. Then there are 2 ovaries. They are small, almond shaped and they are pearl like. So it is very important to have the complete system: uterus, tubes, ovaries, vagina and the hymen, to have the normal blood flow along with the hormones. So once this is intact, then there is no problem. Sometimes it may happen there is some problem, hormonal problem, there is a hormone thyroid dysfunction, or the hormones are not secreted properly, or the uterus is absent, or the ovaries are not functioning. In that case there can be serious problem and the girl may not get a menstruation. So supposing if by 15 or 16 years the girl is not getting menstruation, then the parent should take her to the doctor. So let us see how the cycle duration is. Normally the cycle duration is of 28 days, but it can vary from 20 days to 35 days. If a girl is getting cycle of 30 days, 32 days, 35, it is perfectly normal. But it should not be less than 20 days and it should not be more than 35 days. Then the amount of blood flow, it can vary from the normal blood flow to a very severe, mild to moderate. If the blood flow is very scanty, or if it is less than 1 day, it should be investigated why she is not having proper periods. Similarly, if the blood flow is very heavy, she is passing blood clots and then she has to change lots of pad, which is giving her severe weakness, then it means there is some problem and it should also be investigated. Then the cycle, as I said, they can be regular, irregular. So we have to see that what is the pattern for the particular individual, for the particular person. Everybody varies in their characteristics. So it is not necessary that every woman or the girl will have the same fixed pattern. But once the pattern is established, like a girl gets a cycle at 28 days regularly, and supposing if she is suddenly missing her periods, So then we have to investigate why she is not having period. Is there any hormonal problem, or the second serious problem can be, or important problem can be, is there any pregnancy? So this is like we have to see, that is called as a amenorrhea. The absence of the menstruation is called as an amenorrhea. So once the menarche starts, the period they continue throughout the women's life in reproductive age group till she is old, which is called as a menopause. So menopause means a complete cessation of the period, where the meno means menstruation and pause means the periods are completely stopped. So that will be discussing in separate topic. So from the menarche to menopause, this journey of women with the menstruation can remain same, or it can be changing. The changing influences could be hormonal, stress, exercises, some diseases, or pregnancy complications. So let us see how the menstruation is. So there is one entity called as a PMS, means premenstrual symptom. Premenstrual symptom is not very common, but it can happen with some girls. What do you mean by it? Is pre means the before menstruation. So some girls get some signals, like they get some nausea, sometimes they have vomiting, lower abdominal pain, or the upper thigh pain, leg pain, or there can be a headache. So these symptoms, they give a warning that now the menstruation will start. Normally this doesn't need any treatment, but yes, at times the PMS symptoms can be very severe and which will need a treatment. Generally, if we assure the girl that this is normal, nothing to be worried of, and if she takes care during PMS, like taking rest, but like sometimes there is a nausea, vomiting, then we have to give a symptomatic treatment. So this is about the premenstrual syndrome. Then how to manage a girl or women during actual menstruation. This blood flow means it is a shedding of the blood from the endometrium. So when I told you about the physiology and anatomy, so how this happens, in our uterus there is an inner lining which is called as the endometrium. It is very soft, it is velvety. So when the menstruation starts, then how it starts, it is because of the again hormones. So when the menstruation starts, these hormones, the estrogen and progesterone, they fall, and then again during that time the endometrium is shed out, and this is along with the blood. So this blood comes out of the uterus, and this is called as a actual menstruation. Then the proliferative phase starts. That means after the 5th or 6th day, again the endometrium starts growing, and which is very soft, which prepares bed for the embryo. In case if there is a sexual relation, then there is a possibility of having pregnancy also after the ovulation. So after the proliferative phase, there is a ovulation, which is very, very important. This ovulation happens because of the hormones. There is a LH surge, and every month the egg is released from the ovum or the ovary, which is called as ovulation. The ovulation can be there in every month, or there cannot be ovulation in during every month. So we have to see whether the cycle is ovulatory or not ovulatory. This ovulation normally happens on the 14th day of the cycle. How to know the girl is having ovulation? She gets minimal pain during the ovulation, which is very transient. There can be some spotting, and we can diagnose the ovulation by doing ultrasonography, and we can do the blood test, or there are kits also available to know the ovulation. After the ovulation, then there is a secretory phase. Again, the progesterone hormone is secreted by the ovary, and that acts on the endometrium. The uterus, the endometrium becomes still more softer, more secretory. There are glands, there is more blood flow, and which actually supports the embryo if embryo is there implanted. So this is how the menstrual cycle is, like menstruation, proliferative phase, ovulation, and the secretory phase. So when the menstruation is there, so the woman or the girl gets a symptom. She may not get any symptoms, or there can be mild lower abdominal cramps or moderate kind of pain, or at times the pain can be very, very severe. Normally for the mild or the moderate kind of pain, the girl doesn't need any medication. Even if she takes rest, the pain is manageable. But then sometimes if the pain is very severe, then some analgesics or hot fermentation can be prescribed. But then there are some girls, they get a very severe pain during the menstruation, which is called as a dysmenorrhea. So in that case, maybe sometimes we get a girls to the hospital, and for that time we have to give the injectable analgesics. So we have to find out why there is a severe dysmenorrhea. Normally it is a primary dysmenorrhea, means there is no reason, or secondary means if there is a endometriosis or pelvic inflammation, so maybe there is a very severe dysmenorrhea. So these are the things to be managed during the menstruation. This is about the pain, and the most important is the cleanliness, how the girl should take care during the menstruation. That is called as a personal hygiene. Normally also everybody should take a regular bath, should keep their private parts very clean and dry. But during menstruation, because there is a shedding of the blood, and if the blood is not collected properly, so that can give rise to growth of the bacteria, which will give the infection to the lower genital organs, which can ascend upward. So that is why this coming blood, menstrual blood, should be managed properly. So how we can collect this blood? There are so many methods. One can go with normally a clean sanitary pad, which is to be used frequently whenever it is required. It depends on the amount of the blood flow. If the amount of the blood flow is very minimal or moderate, and whatever the girl feels as per her the requirement, she can use the pads and dispose it off properly. So sanitary pad is used, and nowadays there is a lot of awareness. Even the girls in the rural area, they know about it. The cost is also not very much, so every girl should use a clean, fresh sanitary pad. The other options are like menstrual cup. It is also good, but it requires some training. It should be inserted properly after the sterilization, but then it collect the blood properly and you can discard it. Then there are tampons also. One can use the tampons. The tampon has to be inserted into the vagina. The tampon absorbs the blood, but like with the tampon, sometimes the girl gets lot of irritation, and it also needs self-training. So it depends on the girls, like what kind of the method she wants to use. In olden days, the simple clean cotton cloth was used. Nowadays, now also some girls, they use a very homemade sanitary pads. So the basic thing is one should use a very clean sanitary napkin or the pad, so that there is a proper absorption of the blood and there won't be any infection. And of course this pad should be properly disposed of. So this is how one can take care during the menstruation. There are so many myths that during menstruation the girl should not go to the school, should not play. It is not like that. If she is feeling very healthy, good, then she can attain all her activities. She can go to the school, she can attend her work. There is no problem. There are so many taboos, like not to do a puja or some religious activities. So it is nothing like that, because menstruation is a very natural thing and it should be welcome and should be taken care of. The girl should not feel like they are something bad. So they should be assured, and the family should help her during the menstruation, maybe in case if she is feeling very weak or she needs some light work, or if she wants to be rested. Her diet also has to be good, like what the diet she is taking. Otherwise, but during menstruation, since she is losing blood, she should take a proper iron rich food, because she is losing the blood. If the blood loss is very heavy and her hemoglobin is dropping, then maybe we can give her the iron tablets also, so that she will not get her anemic. We will be going to discuss about the bleeding disorders or the dysfunctional uterine bleeding in the next subsequent topic.